Hi, and welcome to episode 196 of the Untethered podcast. Today we have Dr. Mollie Hayes joining us. Mollie's a functional airway-focused dentist practicing in Omaha, Nebraska. She thought about leaving the profession of dentistry for many years before finding her passion was with helping kids breathe, sleep, and live better by treating the root of their sleep disorder breathing. She's a mom of 4 children who were her original inspiration for pivoting her career in dentistry. Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Welcome to the Untethered podcast. I am your host, Hallie. I'm a certified orofacial myologist, feeding specialist, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, tethered oral tissue, and airway space. I challenge you to keep an open mind and join my mission to get this information out to the masses. Let's get started. Mollie, welcome to the podcast.
Oh, thank you, Hallie. Thank you for having me.
I am excited to chat today, but I really want, if you're willing to share your story with us, I would love for you to tell us a bit about how, I know you're a functional and airway focused dentist currently, but you once upon a time thought about leaving the profession of dentistry altogether. Would you be willing to share with us?
Yes. Everybody kind of has their conversion story. And so this is kind of where mine starts. I wanted to leave dentistry before I even graduated from dental school. I had it in my mind that I was just going to get through this, suck it up, and go find what I really loved. Dentistry for me was like, it was like dating a guy who looked great on paper, and there was just no chemistry ever. I just couldn't fall in love with it. And even as I got going into my career, it was just drill and fill and tell people to floss and brush and don't drink all that soda. And it just bored me to tears. So, I just kind of kept one eye out for other opportunities as I continued to work. And then I really thought about airway dentistry for the first time after my second baby. My son ended up in the hospital and he needed an NG tube to feed for about 7 months of his life. He just continued to fail swallow tests and nobody could figure out what was going on with him. And so I wanted to fix him. And so I started doing my own research. And then, I had another baby and life happens and I just kept doing traditional dentistry. And for me, the line in the sand was just 2020. I just felt like I couldn't trust the health system anymore. And I was part of that, so I just had to make this decision. Am I going to help people be truly healthy? Or am I just going to kind of keep being a part of this system, a part of the problem that puts a Band-Aid on top of things? And so that's when I just decided I'm just going to do it. I'm going to take this opportunity in Nebraska, working with Dr. Trino Nuno, who was already practicing biological dentistry. And when I told him, I want to learn about the airway and I can bring it to your practice, he was all on board. So it was meant to be. I still do traditional dentistry from time to time, but my focus is all about the airway now.
Love that. I love that. I actually found out that a childhood friend of mine, like a really good friend growing up, was working in a practice as a biological dentist. And I was like, I was like mind blown. I was like, wait, what? And
Yeah.
15 minutes away from me. I've since moved because pandemic, things changed.
Yes.
And she's still in the Maryland area, but I was like so spoiled and so lucky to fall into that after never having that, growing up and, having that with, my oldest Lily at the time, she was 4. We put her into like an ALF appliance because they offered that. And I went into a DNA Vivos appliance and they were really doing a number of different things in their practice. In addition to just, biological dentistry, using healthier ingredients, trying to, anyways. So we changed a lot of things.
You get spoiled. You're right.
Oh yeah. It was so hard to find down here when I moved in South Florida, like that wasn't like an hour and a half away or something. And, so
I can't believe how many patients are willing to drive that far. But I think, doesn't that just show you how, people are starting to understand how important this is and you and I see everything through this lens, right? I don't know, are we biased? But maybe this is it. Maybe this is the key to health. So, if you're close to an airway dentist or a functional or biological dentist, you should just take that opportunity.
Yes. Yeah. I'm like, I say all health starts in the mouth. So,
It
and
does.
obviously, you can speak, I can speak to it from like a mouth breathing side and chewing and swallowing and oral rest posture and all that. But, um, talk to us about like what you see as a dentist too, because I know you said you're still doing some traditional dentistry. I know that there's issues with the teeth, with decay, with, I'm sure there's a whole other host of issues that I don't have to rattle off the top of my brain. But as far as mouth breathing goes, all of that, do you see a lot of this in your practice?
I see it every day. And the question I've been asked is, do you think it's getting more prevalent? Is it getting worse? Or are my eyes just open to it? And I think the answer is both. I've been doing this for almost 10 years. And when I first started, it was very rare to see decay in baby teeth. It would happen to me like maybe once a month, and it would be kind of a big deal to see a child with a cavity in a baby tooth. And as the years have progressed, I started to see it more and more. And then again, going back to 2020, it was like someone threw the match in. It was rampant. And so then, and my patients they're healthy. They're more natural minded, holistic. They care about where their food is coming from. So they're eating healthy. We're brushing our teeth. Well, what's left? It's mouth breathing. And it was when I took the Healthy Start course last year that I realized this is it. Mouth breathing is fueling this decay epidemic. And I see a lot of kids in our practice. We're not a pediatric office, but we see a lot of kids, and the overwhelming majority will come in with at least one or two cavities and very narrow palates, swollen tonsils. They're on maybe too soft of a diet. We're busy on the go parents, and we're maybe just grabbing snacks out of a box or a package, or those baby food tubes, applesauce tubes, pouches. Yeah. Oh, I hate them. And it's amazing. I see all these different kids from all these different backgrounds, different families, different ages, and it all kind of looks the same.
Yeah. Isn't that interesting? I mean,
it is.
Everyone just will write that off to like genetics then, right? Like if people it must be genetics.
Yes. Let's talk about that. Genetics are important, but they're not nearly as important as your environment. Genetics can set you up for success or failure, but it's all about that environment. What are you eating? How are you breathing? How are you sleeping? Those are way more important than genetics.
Are there certain things that you tell your families to like look out for? Like if they're concerned, like we are getting more and more calls actually just into my speech practice where like they're saying, okay, and I should say speech, myo, feeding, all the things. But they call and they'll say, okay, our feeding is okay. I don't have any speech or language concerns, but my baby's mouth is open. Like, do I need to be worried? Like, is there something that you advise parents on, regardless of the age, whether it's an infant, a child, or an adult, as far as things to look out for with like mouth breathing or sleep issues?
Yes, so many red flags. And so I use a questionnaire, and it's lengthy. We've got 32 questions to answer, and it's, 90% of kids have at least one of these red flags. And so you have to put the pieces of the puzzle together. So it's not just one of these things or all of these things. You have to take the questionnaire, look at the child, do an exam. But big red flags. I hope parents know that snoring is never normal. Great reason to bring your kid into a myologist or an ENT or a functional dentist if you can. Never normal. Mouth breathing during the day or at night, never normal. Kids who have really restless sleep, so they'll wake up and their bed sheets are all tangled and their head is at the foot of the bed. Bedwetting, it's hard to say what age is not normal, but if you have an 8-year-old who's wetting the bed, that's a big red flag. And even like daytime symptoms, like these kids are just so tired and sleep wrecked, they're moody, and they have trouble focusing. ADHD is linked to sleep disordered breathing. And then, this can go on if it doesn't get stopped into, more chronic illnesses like diabetes, sleep apnea. So Yeah, lots of things that we look out for, but you just kind of have to put the red flags together with, what does the child look like? Do they have swollen tonsils? Is there a tongue tie present that was never diagnosed? Narrow palate. If you have a child with baby teeth and those baby teeth are touching, that's not normal. We need to see spacing between the baby teeth that tells us that the jaws are the appropriate size. So lots of signs and symptoms to look out for. I think the big ones with sleep are snoring, mouth breathing, bedwetting, and then the daytime symptoms of hyperactivity and then attention. These aren't just kids who are choosing to misbehave. Like maybe they're just not sleeping well.
Yeah. I always like to say, like, kids are not inherently bad, and they don't get,
Absolutely.
child like develop and become a little devious and like want to do something to, like, challenge their parents.
Yes.
Yes, that's part of like becoming an autonomous, individual and being. But like infants are not bad. They're not difficult. They're not stubborn. There's like all
They're not
these
manipulating you.
Right. There's all these terms that get applied. And I just sit here and I'm like, if we actually take a moment to stop and think about what we're saying, it does not make sense. I mean, I know that like it's just where our brain defaults, but I think when we open up this conversation to parents, because we get a lot of parents who describe their children this way at no own, like they don't have other information, we'll say, look, like your child is not trying to be X, Y, or Z, or even appear this way to you. This is actually telling us something bigger is going on. Why don't we dive into this, figure out like what we can do together to rip off the band-aids that everyone else is trying to slap on and get to the root of the problem, which I know you're big on as well.
Yes.
So in your practice, I know you had mentioned you took the Healthy Start training. Do you use anything else? Do you primarily use Healthy Start? Like, what does that look like? What age can they start? Like, all questions.
Yes, I only use Healthy Start, and and before I decided to go through with Healthy Start, I researched a lot of different appliances, and the conclusion I came to is that they're all great. And I hope that parents know that, you don't need to do the research on the different appliances. There's so many different ways that we can get early expansion. There's a lot of different ways that we can fix the root of sleep disordered breathing. This just happened to be the route that I decided to go because I think it's very easy and simple. It was easy to bring into my practice. So I only work with Healthy Start. You can start Healthy Start at 2 years old. And I love that about Healthy Start because I'm sure you see it too, Hallie. I mean, we've already done a lot of damage if we're mouth breathing or tongue tied or have a narrow palate. A lot can happen in those first 2 years of life, but they're still very moldable. We can still make a lot of positive changes with this nighttime appliance called a habit corrector. Do I get great compliance in 2-year-olds? Not always, but it's worth a try. And it goes all the way up to about 12 or 14 with that nighttime habit corrector, getting less great results as the years go on. We can also use Healthy Start as kind of a straight teeth, no braces appliance. As soon as a child loses that very first tooth, usually on the bottom, and that permanent incisor starts to poke through, we can take impressions, or in my office, we do a 3D scan, and make a more custom appliance for them to wear for a total of 2 hours during the day, doing like little clenching mouth exercises, maybe 15 minutes here, 20 minutes there for a total of 2 hours during the day. And those are guided appliances. They're not shoving the teeth, forcing the teeth to move after they've come into the mouth. This is guiding them, like almost catching the teeth and expanding into the appropriate spot so that maybe we can avoid braces in the future.
Interesting. Okay. I've always like wondered because I'm like the first to admit, people always ask me, what do you know about Healthy Start? I'm like, nothing. I've heard people speak about it, but I cannot speak to it. I haven't seen it. I haven't had a patient with it. We do, I think, have some patients in my practice, but I have not worked firsthand with it. So I'm like, I can't give you information. The other one, like MyoBrace, for example,
Yes.
a little bit, but not that much. Both of my girls have one.
Okay.
Tried my 4-year-old before putting her into RPE, but she had like croup 9 times already this year. And when the dentist heard that, she was like, oh, whoa, hold on. That's why she doesn't want to keep this in her mouth. Like she's a tiny, she's a tiny mouth. She's almost 5. So we were like, let's pause that. She was doing like 20 minutes a day. And we moved her into RPE with like a forward growth component, upper and lower. And she's like already done after like 3 months. But for her, it's because we were
Wow.
concerned about like OSA. We
Yep.
didn't sleep study, but I'm like reviewing all this research and it's saying like in certain patients, sometimes, certain models are recommended just based on the presentation of
Yep.
the patient. Whereas like with my older one, like a slower expansion method
Mhm.
was, I was like, she's got some hypersensitivity. I was
They're
just
all
like,
so different.
yeah. And
And
she responded great. She still needed some RPE at age
mhm.
now 7. And so she went into like RPE and she's done already. Since
Yep.
it's been just like doing a little bit more like upper and lower, like forward growth a bit, a little bit more
Yep.
lateral expansion. But now we have her in permanent retainers and we were given the myo brace, which we haven't started yet, but it was like a week and a half ago because she got sick. And so it was just
Okay.
like, we need to be able to breathe. So we're now going to try and see, but it sounds very similar in that it helps to then direct growth because obviously
Yes.
she's only 7. She's only lost so many teeth. Well,
Mhm.
some space, the teeth that were already slated to come in, we haven't done a follow-up
You're
CBCT yet.
you're doing it all right.
Yeah, I'm like crossing my fingers. I'm like, this child is in her 3rd thing now. And like, hopefully this is
You
one of the
know,
last ones, but
I
who knows?
know, but 3rd thing at 7, I mean, that would have shocked me 3 years ago. And now I'm like, oh, so she's probably like almost done. And she's going to have this big, broad, beautiful smile and fully formed face and
Yeah.
sleep wonderfully. And I think that there is a place and a patient for these rapid palatal expanders. I do. And I might even have a child at home that will need one too, if we're not successful with Healthy Start. What people need to realize is the sooner you catch these problems, the easier my Healthy Start appliances will work. I'm even talking at like age 8, we're going to have a more difficult road. If it is a severely vaulted palate, I probably will refer you to, we're lucky to have a couple airway focused orthodontists in town. That's just probably out of my hands at this point. So the earlier you can come in, and even if it's not for treatment, even if it's just for education, like at 2 years old, I can do an exam and I can tell you, well, you absolutely have to get rid of that pacifier yesterday or like a year and a half ago. And we can start to correct that maybe with the habit corrector at 2. I've closed a lot of anterior open bites from pacifiers and thumbs with the habit corrector between the age of 2.5 and 3. And it took about 6 to 8 months to close those. So the earlier we act and the earlier we educate, the easier your path is going to be.
Yeah. And it's really cool. I mean, I feel like as I learn more about like what's out there, it also seems that like, obviously some of these things can kind of work in conjunction with others or at different parts of the plan. And I love what you said too, that, you have these like local orthodontists who are airway centric to you. And it was so interesting because I took my daughter to one who was like around the corner and she was 6, like 6 3/4. I don't know. And the whole idea was like, oh, let's wait 6 to 12 months. And she had like a row of shark teeth and they wanted them. And the dentist on the other side of the wall was like, no, let's like, they're probably going to fall out in like the next 6 months. Like, let's just let that happen naturally. Like teeth, and then we'll see what happens with the back teeth. And even though they did a very amazing like airway centric exam, the recommendations were still like, well, let's wait 6 to 12 months or let's pull these teeth out and then wait. And I was like, I don't get it. I don't get it. Like, I thought
did they know who they were talking to?
And I was like, our clients, she's ready for another one. I would rather get this going now because like, I'd rather do stuff during the summer than the school year. Like, I don't, there was like a lot of thought behind the whole process. And it was just, you're good. Come back. It's fun. Like,
just wait and watch it get worse is what I would say. Right. It's not going to get better.
Yeah. So good until you gave me the recommendations. And then I drive to like an hour to North Miami without traffic
That's what it takes, right? When you're advocating for your children.
Yeah. And I'm like, I know she offers ALF, she offers the myobrace, she offers the Hyrax, like with forward growth component, like customizes to each child. And she's using like a combination of these things sometimes too. And so it seemed very like child individualized, on that.
Wonderful.
are following the CBCT, following an airway eval. And I'm like, and my kids are making great progress. So I'm very happy with it, but it's people are like, it's so hard to find somebody who does this. And I'm like, I feel like it's becoming a little easier, but yes, you probably will still have to drive a little.
Because yes, you're going to, and hopefully it's not every 6 to 8 weeks like you would, if you were in traditional braces. Sometimes it's three to 4 months before I check in with a patient, and I feel very comfortable with that. So it's a sacrifice. I feel like I have made so many more sacrifices for my family's health in the last 2 years. Because what is more important than this?
Right. Exactly. If you don't have your health, what do you have? Right. And it's when we know what we know, I'm like, I can't not do
we
this
have this key to unlock everybody's health. We're like, let me share it with you.
Yes. So do you then get any infants in your practice or
I do. And I love it. I love it. I get my baby fix almost every day. So I started posting on Instagram recently that you can bring your baby into the dentist. You don't have to have teeth to come to the dentist. It's actually much easier when they don't. The long held standard, at least the standard I had practiced by, was you bring your child in around 3.5. That way they can sit still for the hygienist to clean their teeth. But you and I both know how much damage can be done by 3.5. They don't have to be able to sit still for the hygienist. If you have concerns, or even if you don't, I think you should bring your baby in to the dentist so I can take a look. We would evaluate for, of course, tethered oral tissues that you might be unaware of. Look at the palate. And really, there's just a lot of educating. I spend maybe 2 minutes in the baby's mouth, looking at everything and evaluating, and then a long time educating parents, things that you and I know and maybe take for granted that not everybody knows. I noticed there's a sippy cup on the floor, and we're going to trade that out for an open cup because it's interfering with proper airway development and swallowing patterns. We'll talk about sleep and snoring and mouth breathing. Baby-led weaning even comes up for the babies getting closer to 6 months. I want to give people more value than I feel like I ever got at those famous well checks that I wasted so much time in. With all of my kids, I would always leave those visits feeling so unempowered, guilty for any decisions I was making as a parent, and just kind of like I just wasted an hour and a half, sitting in the waiting room and waiting around, just to have my baby wait. I really want to add value to your child's life. So when you bring your baby in, I can look at the things, diagnose the things, educate you on the things that are going to set your baby up for their best life.
I love that. And I don't know if it was your account or a different account, or if we were all just sharing it, but somebody this past weekend shared, I'm like, and oh gosh, I probably should look and see who actually said it. I don't know if it was Humorman Lab or what, anyways, but it was instead of asking how are you, when you
how are you sleeping?
How is your sleep? How are you sleeping?
It was, yes.
Yes. How do we change this? How do we make that the norm?
You and I will just start, right? And we'll probably weird a few people out along the way. Let's see how it goes. Report back. But really, you can tell so much about a person's life and their quality of life by how they're sleeping. I always ask patients at their exams, how are you sleeping? And some people know me, and so they know what I'm looking for. And some people are floored. They've never been asked by any dentist or physician how they're sleeping. It's pretty crazy.
It's interesting because we also have a very long intake, and it's pediatric. We just get off for Mayo, but it's long. And, I'll have people comment during the initial eval, they'll be like, I thought it was really interesting that you asked about how I feel when I wake up in the morning, or how, if I've had a history of ear infections, or, and obviously some of these things can be related to speech, but they can also be related to your nervous system, and if things are off balance and everything kind of is connected. And let's talk about eustachian tubes and enlarged, anyways, I'm preaching to the choir here, but it's so interesting to me because then we get that's one of my favorite things is educating and talking about Well, I asked about this because we often see that, adults who are kind of on the go are not really sleeping great at night. Maybe you
Mhm.
fall asleep, your head hits the pillow, you think you're sleeping well because you're so exhausted that your body like immediately passes out, but the quality of sleep is not necessarily top notch. And they're like, what do you mean? Like, what do you mean my quality of sleep? Right now, they're
We've
like exhausted, but I got 8 hours of sleep. And I'm like, that's
yeah.
all I know.
We've just become so accustomed to we assume that we're all sleeping horribly, because we are busy, and I don't
Yeah,
know, the way we
American
live
hustle.
in, yes, we're hustling and we're all tired. And it's almost like a badge of honor, right? To talk about
Yeah.
how tired you are from being so busy. But I mean, I, my life has changed when I started focusing on my own sleep and doing the things I needed to do. I started mouth taping. I don't know how what biologist feels about that, but it's the best sleep of my life when I'm breathing through my nose. I'm putting my phone away a couple hours before bed. I'm like setting the mood, and I'm putting as much effort into, my sleep as I do, like time at the gym or preparing a nutrient dense meal. It's really important. And I read something, I don't take credit for this. I can't remember who, again, an Instagram quote. But the adults with sleep apnea today were the children with sleep disordered breathing, 30 or 40 years ago. And that should knock every parent off their feet, that you can do something about it now. You can change things now. And you're going to change their whole life.
Yeah. Yeah. And it's so fun too when families come in because they're like, oh, maybe I have this issue, or, oh, I didn't realize
Mhm.
it was connected to that. And then it's like this whole family affair. And then we get to work with the whole family,
Mhm.
which I love. Like
Yes.
one improves and they all improve. And I've had so many adults
Oh,
come
how
in, and I know,
satisfying.
yeah, I mean, they're like, I had no idea what I was missing out on, which was not
Oh,
right.
that like makes me tear up a little
I
bit.
know. I'm like, you don't, I think the problem is we don't know any different because this is the way you've lived your life in all of it.
Hmm.
And so it's like,
Yes.
have nothing to compare it to until you do. And then when you
Hmm.
realize what you now have that you didn't, it's like you want it for everybody else because you're like, oh my
Yes.
gosh, you guys are zombies. You were like zombies on speed, walking around
Hmm.
with
Yep.
absolutely no energy to actually expend on
Yes.
all these things.
Just
Like, and no wonder we have all these health issues.
yes. We're just floating to the finish line. Like, that is no way to spend our life. We get one. I know that sounds really cheesy, but like I meet a lot of busy families, and you can just tell sometimes when parents are really stressed out. And my husband and I, we had to have a talk, a couple years ago, like what do we need to do to simplify our life so we actually enjoy each other? I was so tired of like waiting for nap time or waiting for bedtime. We just had to cut like everything, activities and extras, so that we could really focus on, our health and enjoying being together. And now I never thought I would homeschool, and we homeschool our children. We really love being around them. We're sleeping in, we're we've kicked fast food. We are not doing fast food. We're trying to see how many days we can go without fast food. We're cooking together. And I I mean, I'm not tooting my own horn. I used to be like the takeout queen, and I would stay up till midnight, working on chart notes and reading. And I was not healthy. But like you said, like now that I'm here, I just want to tell everybody, like, you have no idea how good it can
Yeah.
feel. Do
Yeah.
it.
Yeah. Well, it's very interesting too. There's so many businesses and like Instagram accounts and people who are like promoting like the opposite of the hustle, like stop.
Yes.
You were literally hustling yourself into the ground. And
Yes.
talking like with my husband and one of our neighbors this weekend about like, European vacation. And we're talking about how like you go certain times of the year based on like, in August, they all just go away for a month and everything shuts
Yes.
down in Europe, in parts of Europe. And
We
it's
should
like,
do that.
hi, doors shut. Don't know when we'll be back. Probably
Yes.
like don't make a reservation because you can't. And
Sounds wonderful.
yeah, I mean it's that. And then there's also like certain cultures that have like the afternoon breaks. Like I know
Mm-hmm.
I don't remember if it was they were saying either France or Italy, one of the two. I think it's Italy. Maybe does like the
Mm-hmm.
3 hour break in the afternoon, and then they have like the really late dinners
Mm-hmm.
at night. And I know like in Spain they do their siesta. There's different
Yes.
that have like those traditional long breaks in the day.
Mm-hmm.
And I obviously haven't like looked at all the research surrounding it to know how healthy that is versus like a long night of sleep or
Well,
something. But
right.
it's
But
something
they
to like do, like
prioritize
enjoying
rest.
life and not the
Yes,
hustle.
I agree with you. I'm seeing more of it too. I see it on Instagram, and then like slowly I'm starting to see it trickle into the practice. People I see a lot of homeschooling families, people who are not involved in like 4 or 5 sports. Like, I don't know how my parents did it. They must have been exhausted. Like slow down. It's not good to be so over programmed and over busy that your sleep suffers. And if you're tired, like, do you really want to make a nice meal at home? Probably not. It really all flows from sleep and good breathing. So there, I'll get off my soapbox.
No, I love that. I mean, I've always been the one who has this like internal, like, like I do what I want kind of thing, but like a very like reference, not externally. And I see like so many kids who are so overly scheduled. They have like almost every single day a week. And I have never signed my kids up for anything on the weekends. I'm like, if we have a birthday party, fine, like we'll go. That's fine. But like, I don't want consistently to have like a commitment on a Saturday or Sunday morning when that's like time, rest time, like we go for coffee. I also have never been one to like push my kids into after school things. Like they ask for things. So like they're both in dance one afternoon a week. And then one does cheer one day, one does cheer another day, and one has a tutor on one of those days, and the other one has cheer. And that's it. Like we basically, and I will add, cheer is at their school. So they just stay a little longer and then they come home, and then it's like, okay, the only thing we take them to during the week is dance. And that's a headache, like for me, to be honest. And I'm not even doing it anymore. Someone else doing it.
I'm with you. We got one activity at a time, and we decided that going into this season of winter that we were going to actually do 0 activities. And my kids were like, oh my gosh, we're just going to be at home like all the time. And it's been so good. We dropped our one activity, and we'll take it up in the spring when it gets nicer. And it's not a big deal to bundle everybody up into their snowsuit and car seats. And it takes like 30 minutes. So I'm a better mom. I can't encourage other moms enough. Like just don't feel like you need a reason to drop things. You can do it unapologetically and without any reason. It's really going to benefit your family's health.
Yeah. I mean, my kids have been begging me for like tennis lessons, and they want to do gymnastics. And I'm like, gymnastics would be on Saturday. Tennis lessons would have to be on a different afternoon. And the way that I operate is this. I'm like, if it can be in our community, which gymnastics won't be, but I'm like, if it can be in our community and somebody's here or can come here, and we can take you like, half a mile over here, we can walk to where we're going, then that would be a fun outdoor activity to do a tennis lesson. Okay, fine. Like I can get on board with that. But yeah, my daughter's like, when are you signing me up for cheer? And I'm like, we'll talk about it after the new year. Like I'm like, it's too much for me. And
too much.
Like, for me, it's gotta be too much for them.
I think about that too. And, the on the go life definitely leads to more like snacks on the go, and like, here's a tablet while you're waiting for your sister to finish up. And all these things come together. It's usually not just one thing that's causing all these symptoms of sleep disordered breathing. I think it's a lot of things. I think the dyes and the food maybe are creating a little bit of the hyperactivity. I mean, I can definitely say that the processed foods are causing the jaws to shrink and recess, as the jaw is kind of a use it or lose it thing. But yeah, I think it's a lot of things. I see a lot of kids who just look like they could just use a little break.
Yeah. I mean, and I know like from all the epigenetics and the research and everything being done, like we're seeing that the jaws are shrinking regardless. Like epigenetics, they're shrinking. And to me, that I just sit here and I'm like, well, how can we optimize what we have? Like, how can we at least make sure that we protect our airway? Because for me, I always tell people this story, like I love it. And it just happened recently, but when I put my 4.5-year-old into an upper and lower expander, and her teachers at pre-K were like looking at me, one of them finally one day, when I think I either picked her up or dropped her off or something late, early, whatever, they were like, so like you're doing this for straight teeth? And I was like, oh God, you guys must really think that I am vain.
How much time do we have?
Baby teeth. I was like, okay.
Oh my goodness. I mean, that just shows you kind of where we're at as a society, right? Braces equal straight teeth. Mouth appliances are for straight teeth. And I am pro straight teeth because then you're less likely to get periodontal disease, gum disease, cavities, but it is all about growing better faces, these sunken in jaws and overbites and flared teeth. Not normal. And it's only going to get worse. Children do not outgrow these issues. They only get worse.
Yeah. Well, and I love that, like, we have new research coming out to support everything we're talking about. When Lily was 4 or 5 or whatever, we did the follow-up. Oh, we hadn't even done the follow-up CBCT yet. It was 3 months into her appliance. So she had just turned like 4. And, I noticed her tonsils were decreasing with the ALF appliance.
That's amazing.
And she's in preschool, and I'm going,
okay,
oh,
that's amazing.
Crazy. Like, I posted this in a Myo study group, and I got like ripped a new one and was told to take the post down and was DM'd by it was like a whole thing. And I was like, I'm not claiming anything. I'm asking if anybody else has seen this, because this is what I've observed with my own child, and I am a professional in this space, but okay, no problem. We'll take the post down. And now we actually have research that supports that this early expansion, or just expansion in general, does in fact, decrease the tonsil adenoid tissue. We are seeing that it's opening the airway. It is a treatment for obstructive sleep apnea, all these things.
Doesn't it make sense? Doesn't it make sense if you can eliminate the mouth breathing by expanding the airway that they would shrink? It makes sense to me. And I am very conservative with the tonsils. And I'm still learning. I probably could learn so much from you about the tonsils, but parents come to me and like the first thing they'll say is like, I've been told to get the tonsils out and I'm not doing that. Like it's not that easy, but I will give you every option to exhaust before we get there. And then if it doesn't work, we give ourselves a limited amount of time to try this with Healthy Start, or, just different nasal breathing exercises. And if we don't get there, we'll know that we gave it our best shot.
Right. Well, and I think it also comes down to like, are we talking about like an emergent case of obstructive sleep apnea where like, I'm really actually not comfortable avoiding this, which is rare. I think that often we have had kids that were rushed for emergency tonsillectomies because they were so enlarged, and they had rushed for a sleep study. The sleep study was like really, really, really not good. We were worried about possibly passing in their sleep because it was a 3-year-old, mind you.
Oh my gosh.
And that's what, like, it gives me chills. Like, that is what made me so passionate about like diving deeper and deeper into this, because I'm like, it's no longer obstructive sleep apnea is not a middle-aged, overweight male issue. It is present regardless of age, size, health status. Like, if you could be the healthiest person in your mind walking around, you eat organic and clean, and you exercise and you take care of yourself, and you don't have any diagnosed diseases that you're aware of, you've got all this going for you, but you're mouth breathing when you sleep, and that's it. To cause OSA, and now you've got bigger issues that maybe you're not aware of.
It's absolutely enough. It's it. Yeah. If you're doing everything right, but you're not breathing through your nose, you're gonna have a lot of undoing to do.
Yeah. Well, and you had mentioned the mouth taping earlier. And I've done an episode on it with my colleague and friend, Autumn Reed Henning, who's also an SLP, myotherapist, all the fun things. And our stance on it is, if like you're an adult and your airway is clear, like go for it. Like that is your call to make. You want to tape your lips, around your lips, like by all means. Like, I've used myo tape. I like the myo tape. I like that it gives you the opportunity to like breathe through your mouth if you absolutely have to. But what we're seeing is like just we've been seeing like blanket recommendations to like tape kids' mouths and like 3-4-year-olds. And that's where I was like, I'm like, number one, if you're doing it in myotherapy and it's an exercise and it's not like long lived, okay, I maybe can get on board with some of that, or even kinesio.
You're standing right there in front of the child.
But also we need an airway eval to make sure that that's even a fair expectation, that they make sure they can physically nasal breathe before we take away their air supply.
I hadn't heard it was being recommended for kids. I feel like it even says on the back of my package, like, do not use on children. There's always, I mean, even I should probably do something else for myself, as opposed to the mouth taping, but I'm going to fix my kids first.
You're an
but
adult, right? Like you can
right, I make that
choice.
decision for myself, right?
And the other thing too is like, I feel like they give it as a literal Band-Aid. Like this is
It
what I said
is.
in the episode. Like before
It
Autumn
looks
and
like a Band-Aid.
I was like, Autumn is a literal Band-Aid. And I'm like, you know what? If it's helping temporarily and helping compensate, great. But like, what is that the long-term plan? Like, has anybody explained
No.
to the adult that there are other options? Have they chosen to forego those other options and this is what they want to do for the rest of their life? Like,
Yeah,
do they know
it's on
when to
the
make
same
tape
level
if
as
they're-
like a CPAP for a child for
Yeah.
me. Like, okay, what is your long-term plan now that you put this 5-year-old on a CPAP? Like, there's no weaning from a CPAP. It's just, this is the plan for the rest of your life. I don't buy that.
Yeah. Yeah. And that's the same thing. I think that I think my goal was to kind of get people thinking a little bit more critically. Like, if we need this, and after a certain amount of time, we have not trained our mouths to exist this way, why? Right? It's like, if you're putting your lips in a closed position for, let's say, 7 to 8 hours a night, day after day, night after night after night, eventually they should presumably do it. It should do it on its own.
We were born to breathe through our nose with closed lips.
Yeah.
Yes.
Yeah. And we've also received adults who do mouth tape and they're like, I feel great when I wake up, but then we realize they're not actually elevating their tongue to the roof of their mouth. Their mouth is kind of down with the mouth moving. And so we've addressed that. And so I'm like, that's where I'm like, I'm all for it, but also like with a lot of disclaimers.
There should be disclaimers inside that package for sure. And I don't know how it would ever work on a child. I think my kids would rip it off right away, to be honest. It's not the most comfortable thing, but yeah, as a dentist treating myself, which I diagnose myself often, it's a good temporary thing. But yeah, you're right. There is always a reason. And this is taken, it's epigenetics. We're doing something wrong as the human race. And we just need to get back to the basics. Our diet, our sleep, nasal breathing. It's so simple and so complicated at the same time.
Yeah. I mean,
a bunch of people can't be done without a team,
right.
Yeah. So I don't know. I could literally talk about this for like, we could go away, on a month long European vacation and we would still not be done.
I love it. Yeah. And that's the biggest question I just constantly come back to. It's like, how do we get the United States of America out of fight or flight? That is a big question because it's not just sleep.
That sounds like an excellent blog post title. I would, or a book. I would read that book.
Right?
It should be on the nightstand of every American. Get out of fight or flight, Americans. I mean the last couple years, it's coming up on like 3 years. I mean, the people that I see out and about that are still, living in fear, and that they're in fight or flight, and they've been in fight or flight, and it really does make me deeply sad. So it's hard. It's kind of hard to speak what I feel, but I know that I see the truth. I'm not right about everything, but I see a lot of truths when it comes to this stuff. And I really think, we got to get out of fight or flight. We got to relax, slow down, stop living out of fear. Makes me sad when I see, kids walking around in these masks like all day, whether it's, school or the store, and just like their mouth breathing behind that all the time. I promise you, if I'm in I do it. I wear a mask. I've been wearing masks before 2020 in dentistry.
They were cool.
Before they were cool. And I find myself sometimes I'll start mouth breathing if it's been too long and I have to change my mask and remind myself. So, we don't have to go down that rabbit hole, but I agree with you. Let's get our kids out of fight or flight. We've got so much life ahead of them.
And I think there's also so many opportunities and ways to go about it now that I'm hoping that this becomes a little bit easier for, professionals who want to get into it or parents who are trying to digest all of it.
Me too.
Stuff. Like it's so overwhelming and there are so many routes now and there's so many opinions. And, I'm like, the best thing you can do is just get started. And if you don't like the
Yes.
path that you're on, you can always change that path. And
Yes.
so that's, I think one of the biggest things is, like you mentioned, a team. And I think that's the perspective that the team needs to come from, because sometimes you get other members who may not be on the airway team, but who are on a medical team who basically telling you, don't do anything. It's fine. Just wait. It'll, it'll get it. And like, no, we are here to tell you, absolutely, you don't go out to snoring. You don't, unless the child, they don't normally snore. Maybe they might stop and then, have a closed mouth again. But if that's not their normally, they're not growing out of it.
Yes. It's hard to find those providers, but I do think, I agree with you. I think it's getting easier. You do have to search. It takes a little bit of research, but here in Omaha, city of, 1 million people, we're lucky to have, I feel like we have enough providers. We have a lot of wonderful myofunctional therapists, multiple release providers, using the laser. We've got a couple ENTs that I refer to. We're really lucky. And I know that not everybody's that lucky. But you have to keep advocating. You have to keep researching. And yeah, the team approach is the only way to do it. I do have parents who come and they think like all the problems are going to be solved in that first visit with me. And sometimes a child can stay with me, we get them in the healthy start, and we work together, but more often than not, I'm referring to a myologist.
Yeah. Well, I love this. I love the work that you're doing. I love your message. I know they can go to drmolliehays.com if they want to find you. We'll put that in the show notes too. But
wonderful.
Anything else, like as we wrap up, anything else that you want to share that we haven't covered today?
Gosh, we covered so much ground. The one thing I always close with is just, early intervention is invaluable. Like really take your 6-month-old to the dentist. If you don't have an airway focused or functional dentist, in a decent drive, I do my best to update my social media and my blog weekly with just little tidbits. So just, have an open mind. You have to kind of unlearn some things. So just have an open mind. You might find out, as I did, that you were wrong about a few things, but I just have to keep advocating for your children.
I love that. Thank you so much. It's been such a pleasure.
Thank you, Hallie. Thank you so much for this chat.
Absolutely. I'll see you on Instagram.
See you on the gram.
Thanks for listening to this podcast. If you want to hear more of these Myo, Tots, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts or pledge a small amount on patreon.com/the Untethered Podcast. If you found value, others in this space will too. So be sure to share this episode on your social media platforms and join us over on Facebook, on my Facebook page at Hallie Bulkin Biz, on Instagram at Hallie Bulkin, and you can head over to theuntetheredpodcast.com to grab a copy of the show notes, where you can also subscribe to be kept up to date on the latest podcast episodes.